Good evening, dear viewers, and welcome to today's program. My name is Dr. Linda Vanotoo, and this program, which is the online pregnancy school, is proudly sponsored by the Promise Foundation and Rivers Tap. In the past few weeks, we have been talking about menstruation and infertility. Last week, we had the opportunity to look at infertility in men. I'm sure a lot of you were surprised because most of the time when we talk about infertility, we think about the woman. Today, we're going to talk about infertility again, but this time we are focusing on the woman. And my guest for this show is again Dr. Donkor, who is a reproductive health specialist and also the doctor in charge of the Tema Mahia Polyclinic. Doc, you are welcome.
Thank you.
And thank you very much for coming.
You're welcome.
Last week we looked at infertility in men. Now today we are going to look at infertility in women. Before we go to that, can you give us a little recap of what we learned last week?
Okay, so we discussed issues concerning men not able to get women pregnant. So most of the focus was on the semen. Our main target with the men is the semen, trying to see how well the sperms are, whether the
What
sperms
is the
are.
semen?
The semen is a combination of the prostate gland fluid and then the sperm itself. So usually the sperms are hidden in the testicles. When there's an ejaculation means when the sperm is coming out. The sperm gets to where the prostate gland fluid is and mixes up with the fluid and it comes out. So that two combination is what we term it as semen.
Okay.
So we look at the semen, we look at the features of the sperm, we look at how good the sperms can be, how fast the sperm can run and cause fertilization. Those were the key things that we focused on. We also looked at infection and all that, and even issues with some of the men and their couples or their wives coming and complaining that anytime after sex the sperm is coming out and it becomes a big bother to them. And these were some of the issues that we had discussed earlier on, and also finding solutions to how these issues can be addressed when it comes to infertility in men. So those were the areas that we were focusing on. That is coming to the hospital, certain medications to be given to the man to boost the sperm count, the speed of the sperm, that is the features of the sperm to become okay. So those were some of the recap things that we did last week.
Thank you very much. And dear viewers, last week we also said that if you are a man or if you have a son at home, make sure that you have checked whether the two testes are down. Because if one of them stays inside the person's tummy, it will cause problems for that particular boy or man. I hope that you did that. And if any of you has any problem with that, please don't stay at home, go to the hospital. The other thing we mentioned was that the opening should be at the tip of the male organ or the penis. So if it is not there, please go to the hospital
as soon as possible. Yes.
And it can be corrected for you. It's very important.
Because there are instances with men, I know about 3 or 4 men that I'm handling now who don't even have testicles. Their testicles cannot be found because the scrotum is there. So the scrotum can be seen, all right, but the balls or the stone that you can feel inside the scrotum is missing.
Wow.
So we need to pay attention to most of our children when they are growing up. And I keep saying that most of the time it's the work of the parents and the midwives who may attend to the mother during delivery or after the delivery to assess all those things, to make sure that all those petty things are in place. And if they are not, they should draw the attention of the doctor in charge as soon as possible so that the necessary actions can be taken. Yeah.
Thank you very much. So that is a recap of last week's topic on infertility in men or males. Today we are looking at, again, infertility. So what is infertility?
Is the inability for a couple to achieve pregnancy after a continuous unprotected sex for a year. So you have a whole year, couple staying together, and if they are unable to achieve any pregnancy, that gives us the clue to announce that couple as an infertile couple, and then further investigations are done. But we need to bear in mind that different countries vary. I mean, we use in Ghana, we use 1 year. In the European countries and in the States, they consider about 2 years. Some even do as far as even 5 years because of the way, the nature of their work. Some may be living somewhere, be meeting maybe once or weekends. All those things can contribute to infertility. So those things are varying in different countries. So if a couple is not able to achieve any pregnancy within that 1 year, we term that couple as an infertile couple.
Okay. Thank you very much.
Welcome.
So, Doc, for the woman or the female, what are some of the factors that lead to infertility?
You see, with women, it's a bit complex, and that is why most of the time in our society, when after marriage, everybody is now expecting the woman to get pregnant. And if there's no pregnancy, the whole blame is shifted to the woman. Unfortunately, the woman be the one to be blamed, that you are not able to carry any pregnancy and all that. We need to bear in mind that certain few factors can play a role. We discussed the issues with men last week. So with the women, we are looking at age, which is one of the main factors. In this area, everybody's schooling. Everybody wants to go to the university. Everybody wants to be...
What men can do,
women can also do.
Yeah. So if the men can go to school, we can also go to school.
So, women will go to school for longer periods, and by the time they start planning to have children, their age may be a big factor, because after 32 years, the level of egg production start dropping. So if at the age of 32 you haven't been able to conceive or gotten pregnant, then
even gotten married. Some people,
yes, some even do as far as even up to 40 years. They are now getting themselves ready in a hurry.
Sometimes it's not their fault. If nobody comes to marry you, we have to pray, right?
Yes, at least that will solve our problem.
Yes.
And then you should go to churches and other places so that you can find your own. So age is a big factor. Another thing we talked about with the men, that was smoking, alcoholism, and then not exercising. Exercise also plays a key role. So you need to be exercising. Sometimes some of the women are too obese. And they are too big. And in our area, when you are obese, we say you are looking too good. That's even a sickness. You are even buying more disease for yourself. You are supposed to maintain your weight and do well to be exercising. So exercise plays a key role. Another major factor, that is women with they're generally called PCOS or polycystic ovaries. When women tend to have a lot of cysts around the ovary.
What are cysts?
Cysts is a collection of fluid, in short. So you may see that by doing scans, because you can't see these things with your naked eye unless you do a scan. So if you do an ultrasound, the doctor or the sonographer can tell that you have a polycystic ovaries. That is, either both ovaries are becoming so cystic. Cystic in the sense that when you say poly, it means many. So there are a lot of cysts around the ovary, and these things can prevent the releasing of the eggs into the tubes for the sperm to meet. So the whole process is just like the sperm passing through the vagina, gets into the womb, passes through the tubes, and when it gets to the tube, at the tip end, that's where it meets the egg, and then fertilization occurs. And when fertilization occurs, then it goes back into the inner lining of the womb. And I'm sure we discussed in the first sessions that the menstruation. So the inner part of the womb becomes like a cushion. So after the fertilization, the egg moves and settles in the womb, and then it starts to grow from there. So when it starts to grow, then the pregnancy, the whole system will occur. So PCOS is one of the key things. If the eggs are not able to be given out or to be released into your system, it's a big factor, and it's one of the main. And some of the things that you can also focus on is prolactin. There is something in your system that helps you to produce breast milk. So some women, even when they are not pregnant, they are able to squeeze their breast and see that there is milk coming out. That is also very dangerous.
Okay.
Because naturally, as you walk around, your system is assuming you're already pregnant. Meanwhile, you're not pregnant because you're already started producing, you're lactating already. And these things will not help you to achieve any pregnancy. So these factors are there. And then use of indiscriminate drugs, some of the women taking alcohol, and a lot. All these things can contribute to when sometimes you are exposed to certain chemicals like herbicides, weedicides, industrial chemicals, especially some of these women can. Another main key problem which we are talking about and we keep talking about all the time, and you could see them on radio stations and other stations, are uterine fibroids. Fibroids are a very key thing that we need to focus on. This time, in the olden days, if you should see someone complaining of having a uterine fibroid, the person might have finished even giving birth.
Yeah.
This time, even at the age of 18 years, you see women with uterine fibroid.
Why?
Things are changing. The way our lifestyles are changing, the food we are eating, there's a lot of agrochemicals in our food. All these things contribute. Radiation is so high. All these factors are contributing to the increase in the growth of uterine fibroids in women. So we need to pay more attention to uterine fibroids, because if the fibroids are closer to the tubes, as they grow, they will suppress, compress, block the tube, and will not allow even the sperms to even go, or the egg to meet the sperm for fertilization to occur. Another key thing that we need to pay attention to is on sexually transmitted infection. It's in our environment is key, because in certain environments, they share washrooms, they share toilets. You can see sometimes early morning there's a long queue. People are going to people are going to do their own thing. These things can contribute to the woman developing infection, and these infections will go the long way of blocking the tube, and sometimes even causing an ectopic pregnancy, because the tube becomes very narrow. The sperm is able to pass through because the space there is too small. After passing through, now fertilization occurs, and it has to come back and settle in the womb. In that process, it stays in the tube and start to grow because it gets blocked or it gets chopped somewhere, somehow. So in the tube, the baby start to grow, and as it keeps growing, you can imagine that the size of the tube is quite tiny. It's just like the pen, the rubber in the pen. So it's so tiny, so it becomes so big and it explodes. And when it explodes, the woman can bleed into the tummy, and this can be very deadly if the person is not sent to the hospital as soon as possible. So infection has been one of the key things, and socially transmitted infection in an era, a lot of people are having sex indiscriminately, and that is a very bad practice.
Very early.
They start very, very early. Very, very, very early. When you go to certain slum areas, even within Accra, at the age of 11, 10 years, just last week I saw an 11-year-old girl who is pregnant, and that was even the second pregnancy. So can you imagine? 11 years, now she's going to have two children.
Babies taking care of babies. Wow.
So you can imagine. So these things tend to increase the risk of infertility. This is tend to, and then even with the vaginal discharges, as we were discussing before even the show, these things are things that are becoming very common. And our women should pay more attention to vaginal discharges. It should be clear, it should not be offensive. By the close of the day, you should see some stains in your panties. When you're ovulating, it's a bit different. It becomes a bit sticky, it becomes a bit more than necessary. Some women tend to also see some of these things after their menses. So these things are very common. But when it becomes offensive, and start to itching, it smells. When it starts to smell, to use very simple language so that those who are not in the field can really understand. So if it smells and becomes itchy at the vulva or in the vagina, don't be putting the salt, the Dettol, and then the warm water and all those things.
Put lemon in water.
And put lemon in water and pushing them there just to ease. No. Sometimes the infection is that smart that whenever you try to put in this intervention, it reverses back and gets to eat into the tubes and sometimes settle behind the womb. And that brings about this pelvic inflammatory disease, an infection that has entered and eaten into the womb and including the tubes, and has now settled at the back of the womb, and it keeps destroying the things that are there. So these factors are very important. We need to take note on.
Viewers, and listeners. I'm talking to Dr. Donkor. Today we are discussing infertility in women, factors that contribute to infertility in the woman. Last week we learned that when couples have tried and they have not had a successful pregnancy, they haven't become pregnant, the woman has not become pregnant, it is not all the fault of the woman. About 30% is due to the man, 30% is also due to the woman, 30% is due to both, and then in 10% of the cases, the reason may not be found easily. Today, we have listened to some of the factors, and one thing that I would want all of us to remember and check for: if you are a woman, you see that your breast is producing breast milk.
Yes.
Please don't stay at home. Go to the hospital, especially if you are trying to have a baby and you have not been successful. And for those who have vaginal discharge, you see, Doc, a lot of people think that there should be no discharge at all from the vagina. And therefore, they keep pushing a whole lot of... And I think there are some people who think that it should be as dry as possible.
It shouldn't be, because the vagina has a flora. When you say a flora, there are certain things inside the vagina that protect the vaginal wall, and these things are there to prevent infection from entering the womb.
Yeah.
It's simple. So anytime you introduce your hand, you introduce water, you introduce chemicals into you destroy the flora that is there, those bacteria and the God-made exactly environment that is there already. So when you do that, you open the vagina for any infection to enter at any time.
Yeah.
And these things can create a lot of problems with the women. So even if you should know, in our environment or in the medical, in the hospitals, when you go to the hospitals and a doctor wants to even assess you, we don't use even the disposable gloves. We use the surgical gloves, the very sterile ones. And sometimes you may have to even clean the entrance of the vagina before even you do the insection. So all these things are preventive measures to introduce infection into the vagina. So we need to be very careful when things are either coming out from the vagina or things are entering the vagina. We need to be very, very careful.
Okay.
Yeah.
So what are some of the infections, the common one that we know around that?
The very common ones that we know are the gonorrhea, the syphilis. Those are very common. And then we have bacterial vaginosis. All these things are, and then the usual white over that we say, that is candidiasis. So when these things appear, as soon as possible, you need to. And sometimes, even before I come back to the infection, on the issue of breast milk, I will also have to urge all the men to be paying more attention, since that is part of the game show. So as you are playing with the breast, and if you're able to feel or see that there is breast milk, please, as soon as possible, draw the attention of the woman to seek medical care. And then back to the infection. So the infections are numerous. There are a lot. What most of the women tend to do is, when they are even using the contraceptives, that's another thing. When they are using the family planning medications, they think that they go on the family planning medications and they can have sex and they will be safe. Because their main aim initially may be preventing pregnancies, but you'll be exposed to other kinds of infections. And commonly, the very dangerous one that is even hidden, and sometimes you may not even see, is the human papilloma virus that can contribute to even cervical cancer. And some of the women now at the very early stages are developing cervical cancer, and these things are very dangerous. So we need to pay more attention to sex, especially, and then infections, especially with women, because the woman's nature is quite complex. So you need to be a bit more enlightened when you are of yourself. And then you know what you're supposed to do, and then what time you're supposed to. And I always say that the very moment you see these things, get to the hospital as soon as possible, as quick as possible. If there's any odor or any discharge or any painful urinating, that is when you're passing urine, there's pain, you're having low abdominal pains, all these symptoms when they appear, or whilst you are there, you see discharges, creaming, a bit yellowish, it's itchy. And some of the women, when they come in the consulting room, whilst they are talking, they are even scratching. And then you'll be laughing at them. And then they will tell you that it's sweet, oh, doctor, it's sweet. Oh. And then by the time they stop, the whole place is sore. So then the pain starts. All these things are quite dangerous in women. So whenever they see these things, they need to go to the hospital as fast as possible, and then make sure that certain medications are given to them. And then follow-ups is necessary. Most women, and then completion of medications. The very moment they start the medications and they see that there's an achievement, they stop. Continuity of the drugs, and then they leave the drugs somewhere because they find it very difficult even inserting and then taking the medications. These are very bad practices when it comes to medicine. If you are given a course, complete it. Complete the course, take the medications till it's done, and then seek for review. That is going back to the hospital for the doctor to reassess you. If there are even tests that needs to be done, go back for the doctor to re-ask you to do the test and see whether if all these infections have cleared. And I will urge the women that anytime they are doing these things, their couples should be involved. I mean, their husband should be involved, because it's a two-way affair. Most of the time, the women will come to the hospital, they will seek the care, you treat them, they go back, they come back with the same infection. And these things keep repeating. And we should know that these organisms or infections, they are quite smart. That is why we even keep changing antibiotics as time goes on, because first day you might use these antibiotics, it may not work, it will work nicely. The following time when the infection reoccurs and you use the same antibiotics, you don't get it. So the bacterial infections and the viral infections, they are very smart, and they tend to change quickly and then find a very comfortable way of spreading the infection, dodging the treatment, and then getting things worse.
Okay, Doc. So, ladies and gentlemen, we have been talking about infertility in the women. What else is there to know about infertility in the women?
What I always urge the women to pay more attention to is not to be too anxious. Anxiety, mental stress.
That's a big one.
That is a very big one. Most of the women will come to you at the hospital and tell you that, doctor, I've been trying. Anytime I have sex, you see the sperms coming out. Some of them are looking for pillows. And I said that then look for blocks and raise their bed. And then make sure your legs are hanging. Some of them even hang their legs on the wall, trying to redirect the sperms. And as we discussed last week, some of the sperms will stay. The very good ones will go. It's simple. So after sex, you can even get up and jump around. The very good ones, the very good sperms, sharp, they will swim fast, they will move. So the ones that will come out may be the ones that are not too good, or maybe an excess. So we shouldn't be too stressed. And then sometimes to our nature of work, you go home, you leave home very early, you come home very late. So you are so much tense, your boss is giving a lot of pressure, you come home there, even the appetite to even have sex is not there. And one of the key things which we should have even discussed earlier is sex. Most people, I think we talked about it last week too. Most of the women are tired and they come back from work and they don't even want to have sex with their husbands.
Even though they want to have children.
And sometimes when they come into the consulting room and you're asking them, how often do you have sex? In a week. You tell the doctor, in a week. In a week is even too much. Why do you have to have sex in a week and you want to get pregnant? So how will you get pregnant if you are not frequently having sex? And that is why we define infertility as continuous, unprotected, frequent sex that will lead to conception. So if you are doing that all the time and you are not getting pregnant, then we need to investigate.
So when a woman comes to the hospital and she says, I've been married for 2 years, and I haven't become pregnant. What does she go through? What are the steps that she goes
when through? You come, we take a critical look at your BP, the basic physical assessment is done. And then we start interrogating. So questions are being asked. And we'll plead that most of the time, if they should come with their husbands, is the best, because then you can engage the two and then try to see where the problem is. So in the consulting room, you start by asking questions, especially the basic questions are sex and what they do. I mean, their work environment, is it so stressful? Do they have time for themselves? Are they really having sex? And then it will surprise you that most of the time they tell you the whole week at home and they've not had sex. and they want to get pregnant. And as I said, these things are not things that will contribute to solving the problem. So we educate them on sex. We look at issues with fibroids, as we have discussed earlier on. So uterine fibroids is also discussed within the consulting room. Another key thing that we also discussed already is infection. So we ask the woman whether if there's any discharge, is there any problem, is there any pain at the lower abdomen, is there any pain when the woman is passing urine, and then also frequency of urine. Is it any 5 minutes she wants to go and pee, every 2 minutes she wants to go and pee? All these things are infections. So these are factors that we try to tease out from the woman to see whether if these things are contributing factor to the infection, to the infertility. Then we do scans. So a scan is being done or conducted in the room. If it's not in the consulting room, an appropriate place is being given to or asked for the couple to go there and have a good scan. So they come back with the report is being reviewed. Another thing we focus on is the tubes. Another thing we do is the hormonal test. So we do ovarian function test. So the prolactin, then the progesterone, testosterone, all those things are things that we discussed last week to see whether if the ovarian function test or the hormones in the woman controlling her system is good. So when these things are seen and you realize that they are okay, then we don't have any problem with ovulation, we don't have any problem with menses, and all those things are questions that we ask. Then we come back to the woman, so to the man, to see whether if the sperms and all those things are. So basically, and then we sometimes look at the thyroid function test. Sometimes we examine the breast, and then we do all those urine tests. You do high vaginal swab, and then sugar. That is one of the key things, because when people, especially women with diabetes, find it very difficult in conceiving. So if the woman is diabetic and is not on appropriate medications, we have to put the woman on certain medications to help. And we should bear in mind that some of these medications can even help in increasing the ovulation of a woman, especially with metformin. That's known to be one of the...
People should not go and buy it.
People should not go and buy it, please. One of the key drugs in helping with other medications that are combined, and then the woman is giving. So all these assessments are done. And then sometimes we assess the vagina to see whether if everything is okay, because some of the women may be too shy, or they might think that the vagina doesn't look too good, it's not attractive, it's not nice. I've had series of women, then said sometimes they come and they are even crying in the consulting room.
That's what?
That the vagina doesn't look nice.
Hey.
And then because their husbands are complaining because
about what?
That the vagina doesn't look nice.
Ladies and gentlemen, this is a new one, right? Do they use a mirror? Have they seen somebody's own? Well, from what we have discussed so far, it means that if you have a challenge and you go to the hospital, there is so much that can be done for you. There is so much. So don't just lose hope. Doctor said that from the beginning, people become so anxious to the extent that they put their legs on the wall just so that every single sperm will stay inside. It doesn't work like that. Last week we learned that there are millions of them. And I don't think you want to have millions in you. You cannot carry millions of babies in you. And one egg or two eggs cannot have all these coming inside. If you have a challenge, the best for you is to go to the hospital and get a proper assessment done.
Exactly.
Doc, what are the chances that somebody who has suffered in silence will come? And I think another thing that we have to bring up is you said that the couple should come together. Sometimes one of them might have one reason why they don't want the other person to be there. So can they tell you in confidence that I have been pregnant 4 times and I have had termination 4 times. In the meantime, the one who married me thinks that...
May not even know.
Yes.
Yes.
So can they come and tell you behind? Because maybe they don't want to...
You see, sometimes it depends on the atmosphere you generate in the room. So if you're able to calm tension, nerves down... Hey,
when they go home, wouldn't he say that? I'm not sure that conversation may come up, but
You should find a nice way, because I can give example. A couple comes and then you ask the lady whether she's terminated a pregnancy before. When you do that immediately, she gets confused because the gentleman will be there and the gentleman may not know. But you ask whether she had the pregnancy before. Has she got pregnant before? She will say yes. So then what happened to the pregnancy? Oh,
that one is between you and the woman. Between
me and the woman. So the woman will tell you that yes, she was not ready at that time. So you don't ask further questions, especially when the man is there, or unless if the man is aware, it's a different story. But if the man is not aware, you don't ask further questions, because either the pregnancy got spoiled on its own, or she had to go somewhere for the termination to be done. All those things, you don't go deeper into it. But then you can tell that she has gotten pregnant before, and this time the pregnancy is not coming. Another thing is that if there is understanding between the couple and these questions are being raised, it helps us a lot to help them, because you need to know how the pregnancy was terminated. Did she take drugs? Some are even inserting herbs. Some of them are inserting sticks. Some of them are swallowing all kinds of coffee. Some of them are even grinding bottles.
And adding blue.
Oh, yes, exactly. Yes. You know them. Some of them are adding, they doing all kinds of things out of desperation. Now the current medication that is around that people are also even using, inserting and then swallowing some and all that. Two up, two down. Yes. All these things, and the very moment that process is initiated, there are certain measures that need to be taken. You need to cover with antibiotics, you need to give painkillers, and these women are ignorant about these things. So they may do them, and then they open the womb for infection to enter, because the baby that they are terminating, and most of the time they bleed for about a week. So continuously are bleeding for a week, it becomes offensive.
Yeah.
And then the infection, that makes it offensive, and then it gets into the tubes, and then it tends to destroy the whole system.
Doc, before you continue, I just want to bring this to the attention of parents and our young ladies. Please, do not, if you are not yet married, don't get yourself into trouble by becoming pregnant and trying to have a termination. I always remember long ago, a young lady of 17 who had termination that I don't know where. She came to the hospital, and at that age the uterus had to be removed because she had this massive infection, and it was difficult. And again, some time back, a young lady was sent to the hospital, and the people were surprised, the midwives and the rest on duty were surprised that there was a stick coming out because she had gone somewhere to terminate a pregnancy, and they had pushed a stick, and this had made a hole into the womb,
and I've actually encountered a lot whereby we have to sometimes even chop half of the womb away. And these are very dangerous instances. They are very young at that age. They go to all these quack people, and then they put in the sticks, and then you now have to remove the sticks and then do a proper evacuation of the womb and clean the womb and all that, and then put the woman on medications and all that. These things are very dangerous. So we tend to educate the women not to be doing all those or engaging themselves. Seek proper care, seek proper attention, go to the professionals, go to the hospitals, not asking friends.
But sometimes they are afraid. But now we are telling you that if you have any problem, please go to the hospital. See a doctor. Let the doctor talk to you. That pregnancy may even be your only one that you may have in your life.
Exactly.
You never know. The fact that you have made a mistake doesn't mean that you should kill yourself. And I believe that we have trained people, the pastors are trained, we have counselors, we have doctors who can support you to go through any challenge. But first of all, please, if you are not married, stay away as much as possible. It is to your own benefit. At the end of the day, you will be the one who will be smiling. Doc, so how successful are
so assuming with issues with the tubes, with the termination, and that can contribute to some of the tubes getting blocked. So when the couple come, apart from the lab tests, apart from the sperm analysis, apart from the hormonal tests, apart from checking for infection, the urine, and then doing the ovarian function test, sometimes we do thyroid function tests and all that. we need to be sure whether the tubes are open. It's very key. So this time there are modern technology. Either you do a laparoscopy, so the woman is put to sleep, holes are created in the tummy to be sure whether if the tubes are intact or not. So that is viewed on a screen.
Yeah.
Or you do the HSG, whereby the woman lies down and then a contrast is pushed through the vagina to the womb to see whether if the tubes are intact. These things are very key. Now, the very moment we realize that all these parameters are okay, then whilst we are investigating these parameters with the woman, we do likewise for the men to see whether if the man's sperms are okay or not. So these things are done together. That's why I always want to have the couple together. If the woman comes fine, the very difficult situation where we haven't touched is most of the time the men will refuse to come to the hospital. They are so proud when they come to the consulting room. They are so proud as if they know it all. And surprisingly, after the semen analysis, they wrinkle in the consulting room as if they want to vanish from their chair in the consulting room, because the semen analysis that will come out will be very bad or is so poor. And interestingly, what we need to also bear in mind, some of the women, some of the men, they know already that their sperms are not good. So they won't even come.
Okay.
So before you even raise that topic, they start unnecessary argument and unnecessary quarrel, and then that conversation ceases.
Wow.
So the women should be careful and should have more strategies in trying to pull the men into the hospital. So what I do is, most of the time when the woman is alone, I try to let her convince the husband to get the sperm to the lab. I mean, sometimes I don't insist that I should see the man's face, because if he's refusing to come to the hospital, there's no need for him to even come. All we need is the semen, to be sure whether the semen is good. If the semen is good and the woman too is fine, then we have a good chance of getting them a baby. So we educate them, we counsel them, and then we put them on certain medications. If there are issues with ovulation, we work on it. So we give drugs. If there are issues with the tubes, we work on the tubes. But unfortunately, most of the time, the tubes are not too successful. If the tubes are blocked and totally blocked, there's no way. Currently, people are doing all kinds of things like blowing. I've seen so many medications being advertised that opens tubes. Unfortunately, these medications cannot do much, because if connective tissues have set in, I mean, like a scar has already occurred in the womb, unless somehow the tube have to be opened and then repaired, even that one will not help, because the space there is so tiny that the least thing that you do can block the tubes. So if the tubes are blocked, then another issue comes in, whether we should do an IVF. So most of the time, artificial insemination, so in vitro fertilization. So the eggs are collected from the woman, the sperms are taken, and then the fertilization are done. Normally we call it test tube babies. So it's done in a lab, and then it's inserted into the woman for it to grow. And
because the womb is okay.
The womb is okay. There's no problem with the womb. The womb is fine. So the woman can carry the pregnancy. So those things are done. And because it's quite expensive in our environment, most of the time they try to do twins. So 2 babies are inserted. Buy one, get one free, because you are paying a lot for these processes to be done. So the sperm is taken. But what is surprising nowadays is that a lot of the men are coming with low sperm count. A lot of the men. Most of the time, I says the woman, everything is fine with the woman. You go to the man, there's chaos. And even following or taking the medications religiously is a problem.
I know someone, in fact, she said that the husband went to the hospital, he was seen, he was given medication. For him to go back has become a challenge.
Yes.
Why don't they want to go?
They feel so proud. They are the head of the family. They are the bosses.
But that's why you should show example.
So if you don't even take the initiative, you don't take the first step in trying to solve the problem of your own, you can imagine what will happen if tables had turned If the woman had had a problem, I'm sure that he would have been throwing tantrums here and there, banging doors and then shouting. And then the women are always in trouble and then they'll be crying and all that. But when they are in trouble, they won't even take the initiative. They won't take the zeal to even come to the hospital for treatment to be given to them. And if the treatment is even given to them, they don't even take it. They'll go and put it somewhere. In the evenings, gather with friends, drink beer, check in chichinga, eat unhealthy eating lifestyle. All these things will even compromise the situation. And then, strangely, some of the men tend to have, should I say, side chicks or girlfriends, and then the girlfriend comes and they say he's pregnant. Somebody's pregnancy is bringing to you. You are going to name someone's baby. And then they will be so excited and then moving around and saying, hey, I'll go to the hospital, I've gotten this person pregnant, I've done this, I've done that, I've done that. Meanwhile, the people he claims he had gotten them pregnant are people who somebody has also gotten them pregnant. They think the person is not too resourceful, is not having any. And they push it. They push it to you, and then you carry the pregnancy. So, going to the hospital is one of the key things. Get there early, after a year, if you are noticing that you are not getting pregnant. Several investigations will be initiated. Follow those instructions carefully. Do as the doctor says. Go through the system. Check all the infections. Check for sugar. Let the man do the semen test. Let's check for the ovarian function test. Let's check for the tubes. Let's check whether the woman has fibroids. If there are fibroids and they are very huge, that's another key thing we need to look at. Some women with uterine fibroids, the very moment you mention fibroid to a woman, as if you should bury the woman. You should look for a grave and put the woman in there. The very moment you mention it, and then their mood changes in the room. That is not the case. There are certain fibroids that can be there, and the woman can give birth as much children as she wants. The fibroid will still be there, so it shouldn't be a problem. In situations where the fibroids are extremely big, that is where you need to pay more attention to, or has to be removed. If they're very, very tiny, like egg or yolk or groundnut in sizes, these things you shouldn't pay more attention to. You should rather be in a hurry to get pregnant. So I tell most of the women who come for usual normal scan, I tell them, hey, there's fibroid there, but don't be discouraged. Get ready and start planning for your marriage or pregnancies and all that, and then as soon as possible get pregnant, so that, because as time goes on, the fibroid grows and increases in size, and these increments or the enlargement of the uterine fibroid can block the tube, and when it blocks the tube, it can cause more problems. Then the tubes becomes blocked and you can't easily get pregnant. Another thing we need to bear in mind that when they are very tiny, or they are kind of in average sizes, and then you open and you want to remove the fibroids, if they are closer to the tubes, because you have opened as a surgeon, you remove them. And when you remove them, you destroy the tube because they are closer to the tubes. And when you are closing up, trying to secure bleeding in the process of suturing, repairing the womb, you block the tube. So the woman tells you she's had the fibroid operation done before, and after the procedure, now she can't even get pregnant at all. Even those days with the fibroid, she was getting pregnant, but she was getting miscarriage. There are so many things you can do when the fibroid is there and there's pregnancy. You can work on it.
Doc. Dear viewers and listeners, we have been talking about infertility, this time in the woman. If you have a question, kindly send me a WhatsApp on 059 242 0625. 059 242 0625. Doc, so in your practice, have you had couples that have come and they've been very, very successful and now they are happy? What would you tell those who have still not been pregnant?
Fortunately, a lot of women come and they are able to get pregnant. A lot of women. If they are able to go through the procedures, the instructions, they come out successfully. Sometimes the sad thing is that the woman will come, or the couple will come, and the husband doesn't stay at home. He's in the US. The following month he's somewhere, he's in Dubai. The following week he's here, he's that kind of. So the husband is always not in the house. A lot of women come and the prescribed medication, you know, women are much careful with certain things in terms of, I mean, when it comes to caring and all that, women they do better than even the men.
Yeah.
So when you give them these instructions, they follow the instructions carefully, and then there are certain medications that are also even given to them during menstruation, the second day of their menstrual cycle. There are certain drugs that are being given to them. When they take these drugs, they become very fertile.
Yeah.
And then during they have intercourse, then they get pregnant the following day. Just last week, a woman who has been looking for pregnancy for about almost 8 years comes, and then at the age of even 40, and then she gets pregnant, and she was so surprised after roaming here and there. Now she's able to
thank God.
She's thanking her God.
Yeah.
Because there are a lot of drugs in the system, and you need to know who knows how to use those medications. Some of them may be mixed up, and then there are timelines with the drugs. Some are supposed to be taken only for 5 days. Some are supposed to be taken only for 14 days. You have to follow strictly the medication that was given to you.
It's for both of them.
It's for both of them.
Even if it's the man who is being treated, he should have the support of the wife.
Exactly.
If it's the wife who is being treated, she should also have the support of
the woman,
husband.
Yes.
And I believe that they also have to work on their emotional state.
Yes.
You know, a lot of people become depressed during that time. Doc, we have a question. A lady says that she had an ectopic about 2 years ago, and after that she's not been pregnant up till now. She's married. Now she went to the hospital, and you talked about the SDG where they push a dye to check
whether the tubes are intact or not.
And she said that they say the tubes are blocked, and the only way she can have babies is to have this artificial
insemination.
And she wants to know whether that is truly the only option for her.
Unfortunately for her, that is the only option. Infections getting to the tubes will lead to an ectopic pregnancy, and sometimes even termination of pregnancy. If it's not properly done, you introduce infection, or infection will block the tube. Now, unfortunately, most of the time the pregnancy will come in the tube that is better than the other. So the correct tube rather comes with the ectopic. The one that is not functioning at all, the sperm was not able to pass through, so there's nothing wrong with that tube. And most of the time, whilst we operate and we bring the womb out and we are trying to assess the tubes, you will not be able to see the inner part of the tube to see whether if everything is functioning, everything, the hole or the space in there is quite good or not. So the good tube was where she had the ectopic. Now, with the ectopic, the tube will be cut off. So she'll be left with the other one. So that left or right tube that she had the ectopic in is gone. The other one is already blocked, so there's no way she can get pregnant. And if the womb is fine, then the egg retrieval can be done. And then, as I said earlier on, we call them test tube babies. But this time it's becoming a norm. Yes, it's becoming normal for you to go through the IVF system and then have babies. And then they are your babies.
Yes,
I mean,
they are your own egg,
they are not going to steal any sperm from anywhere. Yes. They are not going to take any eggs from anybody. They are your own.
Yes. Doc, we are gradually coming to the end of our discussion. I know that there are so many questions, but then before we go, what are your last words for women who are trying to become pregnant and they are probably getting so frustrated that they are becoming depressed? What would you tell them?
I will let them know that they need to keep fighting. It's like a war. You have to fight so you achieve whatever you want to achieve. So don't give up. Follow instructions when you go to the hospitals. Go through their procedures, go through their system, their checks, and then whatever you are being told to do, you follow those instructions and then you do them. What sometimes keeps the women a bit more frustrating is they wait till they are over 40 years almost 50 years. They are now in a hurry, jumping from one place to another, looking for. And sometimes when they come to the consultant, they want you to do magic. There's no magic in medicine. So there's no way you come to the consultant, you talk to the doctor, you want to get pregnant. Instantly you are pregnant and then you carry the pregnancy home. No, it's not done. You have to fight. And it's a lot of work. So you need to keep to the work, do it carefully, do all the instructions, and there will be a success. You will always get it. A majority of people get pregnant when they are able to go through all the. So women should not be depressed. They shouldn't be discouraged by their men when they are not encouraging them or supporting them in coming to the hospital to see a care. I always advise that they should come to the hospital early. It's better to assess them early. Their chances of getting pregnant is quite higher than when they are in their old age. And then in their old age, even stimulating the ovaries is a problem. And the eggs are not even responding to your medications, and it becomes a worry. And then the mental stress alone compromising the whole thing, and then their husbands jumping, not staying, all kinds of social, economic activities or problems compromise. But all these things shouldn't make them give up. They should continue to fight, and then there will be success, and they will be carrying their babies in white and then thanking the Lord and giving them ceremonies.
We will definitely thank God. Ladies and gentlemen, we are coming to the end of our program for today, and we have been talking about infertility. We've looked at infertility in the man, we've looked at infertility in the woman. But there are things that are common, and one of them is that you cannot wish to be pregnant without wanting to go through the process by which you can become pregnant. And as he said, there's no magic. The doctor cannot do a magic in the hospital for you. So if you have been to the hospital and you've been given some medication, you've been given some lab tests to do, kindly go through. And because we serve a living God as well, as you do this, you pray. And there are so many couples that have become pregnant, having gone through and not giving up. Don't give up.
Yes.
Never give up. Because our God that we serve wants us to believe in Him. And once you have that faith, you will make it. Doc, we want to thank you so much.
Welcome.
You have taken us through menstruation.
Yes.
I hope that people can now calculate their cycle.
Yes.
If you have a challenge calculating the cycle, you have our number 059 242 0625. Will help you to calculate the cycle, because it's important that you know, because that is where you know when probably you are ovulating. We have also learned that for the men, it's important that your semen contains good sperm that can swim very fast. So if you are treating infertility and you go to the hospital and you are asked to do a test, please do it, because that's the only way they will know whether the sperms are good or they have to give you some medication to help you. If you're a woman, please, there's so much that as a woman you can do. Don't start putting things into your private parts in the bid of getting rid of some smell that is not there. But if in the process you see that you are having a discharge or you are itching, please don't stay at home. And for those who have been moving from one person to the other, the chances of you having an infection is very high. So please don't do that. And if it happens that you have any challenge, please go to the hospital. See a doctor, you'll be well treated, and follow every procedure that you are asked to go through. Take your medications as prescribed, and by God's grace, you'll have a baby on your lap. And don't wait till you have been there for 10 years before you start seeking care. As soon as possible after marriage, if after 1 year you have a challenge, you haven't become pregnant, please go to the hospital. Thank you very much. This has been the online pregnancy school. My name is Dr. Linda Vanotoo, and this program was proudly sponsored by the Promise Foundation and Riverstep. Thank you for watching, and see you the next time. Have a good evening. Bye.
Bye.